Do you want to learn how to control the nausea during chemotherapy? In this video, I will explain why this happens and how we can decrease it. The three biggest and most frequent adverse effects of chemotherapy are bone marrow suppression, gastrointestinal disorders, and hair loss. In the gastrointestinal disorders, nausea and vomit are very common, but not all of us will feel it the same way. So, what can cause nausea and vomit? Gender and age are very important. It seems like young women are at higher risk. But our stress is also very important in this kind of symptom. If we feel very stressful or very fear, we can have more nausea and vomits than other people. And in last place, and very important also, the type of chemotherapy. Not all are at same level. Some chemotherapies can cause more nausea and vomits than others. Cyclophosphamide, cisplatin, doxorubicin are very common chemotherapies with higher risk of causing nausea. Nausea can be of two types. First, it can be acute. It means that it can occur in the first 24 hours after chemotherapy, or can be delayed. It means that it can happen more than 24 hours after chemotherapy. Cisplatin can cause these two types of nausea. Normally, patients will feel nausea in the first hours after the session, but also a second peak 2 to 3 days after the session. Besides cisplatin, also carboplatin, cyclophosphamide, and anthracyclines can cause these symptoms that we call delayed nausea. And for example, anthracyclines like epirubicin, doxorubicin are normally taken together with cyclophosphamide. So why do you feel nausea and vomits? Why they occur? Let's try to understand it a little bit better. The nervous system seems to be involved in this mechanism. Right now, we understand like the brain and our neurons in the intestine, that we call now the second brain, interact together. So, when we take chemotherapy, these drugs will stress our enteroendocrine cells and they liberate serotonin. When enterochromaffin liberates serotonin, they stimulate the nerve cells. They go to the central nervous system, and if they have a light stimulus, we'll feel just nausea. But if the stimulus is too strong, we can vomit. So how can we prevent this kind of symptom and reduce nausea and vomits? Well, in medicine, there are two kinds of drugs that are mainly used. First one is corticoids like dexamethasone, and the other ones are serotonin receptors antagonists like ondansetron or dolasetron. But not always they are so effective. What kind of other solutions do we have? Let's start by the simple ones. With a lot of scientific evidence, we can use acupuncture. There are no risk of interactions and is, in general, very effective. Or we can use a kind of pressure acupuncture, also known by acupressure. This is a technique that we can apply to ourselves or to other people with just our finger. We just have to localize the PC6 pressure point, also known by Neiguan in Chinese, and apply pressure for 3 minutes in this point. For that, we can use our thumb or a pencil eraser. Very simple. And where is it, this PC6 pressure point? It's very easy to find it. We just have to count 3 fingers below the wrist line between the 2 tendons. On that, we'll feel a point, and you just have to pressure clockwise, counterclockwise, or just pressure, and in the left arm, in the right arm, doesn't matter. You can do in both arms. Besides this technique, which I recommend often to my patients, drink ginger tea is also very effective. Studies like this one tell us that ginger tea acts like those drugs I talked before. Ginger tea blocks serotonin receptor, helping controlling nausea induced by chemotherapy. So this is a very effective way. For that, we just need to know that we need to drink between 3 to 5 cups per day of ginger tea in the chemotherapy day until 3 to 5 days after the chemotherapy, and then we can stop it. If you want to know or learn how to do this tea, check the video that I made for you. Also, besides acupressure, ginger tea, managing your diet is very important because some foods can increase nausea and other foods can decrease nausea. So, also invite you to check my video about diet to manage nausea during chemotherapy. If you like this video, share it with those who need to learn about this. And you can also support this channel just by subscribing. My name is Andre Dourado, and I'm an integrative cancer support specialist. Thank you, and see you in the next video.